Moms. They wiped our tears when we were sad. They pushed us to be the best version of ourselves. They challenged us to move out of our comfort zone. At the end of the day, mothers want to give their kids the best possible life. But what if a mother can't provide for her child? Or she isn't ready to raise a child? Though a kid can be the greatest joy to a lot of women, there are several reasons as to why she would want to avoid a pregnancy. In order to further understand this, let's first look at some demographics. 50% of women in the US are faced with unplanned pregnancies every year. This number increases when we look at developing countries who experience 65% of unplanned pregnancies. 70% of these women are unmarried. 32% are of a minority. 60% had a high school diploma or lower. 23% said they were at least 150% above the poverty line, which means they make about $18,000 a year for a family. 87% of parents said that they were not ready to be a parent yet when they found out about their unplanned pregnancy. 60% account for women that used no contraception and got pregnant. And of this 60%, 18% have proper access to birth control. The bottom line here is that women that need access to birth control the most are not receiving it. It may become even harder to access birth control in the coming years as the Trump administration wishes to remove the part of the Affordable Care Act that requires employees to cover birth control in their health insurance plans. This would affect 62 million women. The administration also wants to defund Planned Parenthood under the Title IX Act. This would affect 2.4 million women who currently receive birth control from them. Now, let's look at a video from Planned Parenthood that further illustrates the effects these political decisions would have on the country.
Planned Parenthood provides care for patients across the country, no matter their zip code, their income, their race, their immigration status, their sexual orientation, or gender identity, no matter what. In Washington, some politicians are trying to defund Planned Parenthood, but what does that really mean? Millions of people come to Planned Parenthood for healthcare services like birth control, STD tests, cancer screenings, and sex education. And Planned Parenthood proudly provides safe and legal abortion, a medical procedure federal health programs won't pay for except in extremely rare circumstances. The care that patients get at Planned Parenthood prevents an estimated 579,000 unintended pregnancies each year and saves lives through early detection of cancer and other life-threatening conditions. 60% of the people Planned Parenthood serves rely on federal programs like Medicaid to help pay for their preventive and essential health care. And just like every other hospital or doctor's office that takes Medicaid or any other insurance, Planned Parenthood is reimbursed for the specific care we give each patient when they come to us. So when politicians talk about defunding Planned Parenthood, they're not talking about striking a line in the federal budget. They're talking about blocking millions of women, men, and young people from getting essential and life-saving care. Here's what their plan would cost Americans. An estimated 1 in 5 women in America have been to a Planned Parenthood in their lifetime. Nearly half of all Planned Parenthood patients are people of color. For many people, Planned Parenthood is the only place they can get care in their community. In fact, more than half of Planned Parenthood health centers are in rural or underserved communities. Defunding Planned Parenthood would be disastrous for our nation's health, and the people who would be hurt most would be those already struggling to get by. Planned Parenthood doctors and clinicians open their doors every day because we believe that every person should have access to the care and information they need to make important decisions about their health and their future. These are basic human rights, and we're doing everything we can to protect them.
In summary, better access to birth control will reduce unplanned pregnancies, reduce child poverty, create fewer health disparities for disadvantaged populations, improve family well-being, and lower public spending. Women should make their own choices about their body, so why can't we let them do so?